So good afternoon once again. I'm not Antonio because my colleague that all of you know very well because it was one of the main actors in this working group on the national cancer plans. Unfortunately, missed this opportunity to present, and this work is entirely up to him. So I'm here just as a speaker. I do not pretend, and I hope, as it happened this morning for the ministry, that my quality of voice and my presentation will be at least half of what he could have made. So apart from this, you might find this presentation somewhat different from others because, as you might know, we put in our national cancer plans also some aspect of general methods on planning that might be peculiar to this plan. So you will forgive me if we will have some minutes about these kind of aspects. First of all, let me say that despite we had before several planning documents on cancer, the present National Cancer Plan, which formally is in place from 2011, is the first time that the Ministry of Health is putting in place a large effort to involve stakeholders, including clinicians, professionals, civil society, and patient organizations to set up this plan. And it's the first time that this plan is discussed with not only at national level, but also with regional authorities. And this is also something that I will try to focus later on. Clearly, as for many other policy documents, this kind of planning bears from different sources. The first clearly is the actual evidence of having a large burden of cancer, despite, as we saw in the figures, Italy has not a prevalence higher than other countries, but the burden of cancer is in a large country as Italy is clearly one of the major public health challenges. On the other side, there is clearly an international commitment not only for having something done on cancer, but also for having a clear planning of the national resources. It is important also at the country level because Italy is made of 21 individual regions which are more or less fully responsible of their health planning. So it's very important for us to bridge inequalities that this kind of health organization unavoidably brings with it. The main goal of the plan is to have a comprehensive management of patients by the national health system. Despite the plan focus also on other aspects which are not specifically related to the national health system, clearly the main worries for us was to have a patient-centered approach. So clearly the ideal path that we follow in the description of the plan is to have an individual from the very beginning to a very late phase of the disease and try to imagine which kind of services the region should offer for all these various stages of the disease. The second aspect is to have, for the first time, shared priorities and common goals among all stakeholders, which was not something that was not very well done in the past. There are also some principles that I will not like to list in details. You can find it on the slides. That although they are not written explicitly in the document, they have been keeping strongly in account by the writers in order to ensure that all these principles that are fundamental to the national health system as a whole, but are particularly important for cancer treatment and prevention, would be applied also in the individual actions. The structure of the plan has had these following steps. First, making an individual decision on the areas of priorities, focusing effective needs within the selected areas. Last, identifying goals and definition of specific action plan for these individual sectors. I would not like to list all the contents. Clearly, as you can see in the slide, is a very broad spectrum plan, and there's many individual items. I just want to focus your attention on the last lines, where there is also a specific part dedicated to innovation and all those aspects of cancer that someone might consider specifically limited to research, but that in our opinion are and must be a fundamental part of any planning, because in the cancer field there is a continuous renewal of ideas, and it's important that the research results and the activities that are implemented in cancer research centers are as soon as possible transferred to the whole sector. Many areas of the plans are clearly cancer prevention, and in this case there are two different chapters. One is related to health promotion and primary prevention, which is clearly is one of the priority of the country. The second one is secondary prevention. Tomorrow there will be a specific session on this, and I think also there will be the presentation of some data from Italy. The situation of cancer screening for some aspects in Italy is similar to that in Europe, in the sense that there are regions where these activities are long-standing, have been already in place since many years in a well-organized way, while for others or for some specific cancer screenings, this is unfortunately not the case, and there are still many iniquities to be overcome. The second aspect is on control activities, and in particular the focus is on integrated cancer care and all the activities that are related to this overall wording. The third is dedicated to aspects that, as I mentioned, one can consider not strictly related to the activity of the national health system, but for us are very important, like research, the activities of cancer registries that luckily in the last few months have seen an important improvement in Italy due to approval of a specific law concerning data management, and also that it's not specific to cancer registries but has reached an important result, because up to a few months ago several of the Italian cancer registry could be considered brackets illegal under some of the various privacy regulations. Now we are very lucky that also on the inputs given by this plan, the legislation has been changed. Now there is still something to be done at the level of implementing this legislation, but we consider that an important step forward. This would not have been possible without this previous discussion in the preparation of the National Cancer Plan. There are also, at the end, some specific focus on specific themes that are not in the rest of the plan, and several of them, as you can see, are also part of EPAAC and of the next joint action. That means that we share a common perspective with the European discussion. Passing to governance issues, that I think is one of the peculiarities of this Italian plan. As I mentioned, from several aspects, Italy is a small Europe. So when we speak about what happens in Italy, I think it could be interesting to be referred to what could be in the future or is already a European discussion. First of all, Italy and Europe, of course, is even more is a decentralized country, and so this implies that not any decision can be taken at the national level, even if the government and the Ministry of Health can establish some very broad regulation and, say, principles to be adopted in a specific sector, we cannot oblige anybody to take decision and even less to take budgetary decision. So it's very important that having a planning that is managed with the regions in order to ensure that at the level of implementation, what has been agreed could be really implemented. The last but not least, relevant importance of stakeholders has been of particular importance in this planning. A specific representative of the civil society and the scientific society has been appointed by the Minister of Health at that time in order just to write the basic elements of the plan with the ministry officer. Clearly, the plan and in general our policy represent an alternative to the classical vertical model of planning, because this is no longer possible, at least it's not in Italy, and I suppose it will never be possible in Europe with a very top-down approach, and so we somewhat happy to do that or not, we have to choose a very different model of interactions, which takes care of the different responsibilities and try to involve all actors in a perspective that should be managed in a common way. I do not have time to focus on this particular issue, stewardship, that I think most of you are familiar with this wording, which has not been invented by Italy, but is a clear commitment also by WHO. In particular, it was clearly stated in the Tallinn Charter on the National Health System. And I think stewardship is the right way to manage a situation where responsibilities are decentralized and are shared like it happens in our country. Clearly, it's a model that might have criticisms and may be somewhat to be tested as regards, and in particular, its efficiency to produce decision in a short term. However, it has demonstrated in our country to make it better than attempts to do it in a different way and a more top-down approach. The plan also includes and foresees some tools for implementation. These tools are say, still in progress in the sense that the technical documents are more or less ready, but since we want to adopt the same approach that has been used for the whole plan, these documents will now go in a discussion with a conference between the state and the regions, and we hope to have them fully adopted at half of 2014. Three major tools for implementation are foreseen in the plan. The first is the guidelines for implementing oncology networks, and I will try to say a few words afterwards, just not because this might be entirely referred to the discussion of today, but because this is a bridge with one of the themes of the next joint action. The second is a document trying to identify, and this is a question that we had also at the lunch with the minister, which part of what we are doing now should no longer be in use and should be replaced by new procedures and by innovative ways of producing the same results. And this is quite crucial in a field like cancer, where innovation plays a key role in the field of also of healthcare. Last but not least, as it was mentioned also this morning by other speakers, there is the need of having an HTA document for the approach of the new kind of interventions, and particular for new drugs and strategies that will be implemented in the future. Just a few lines about this issue of the network. I think also EPAAC has produced excellent results in this. Clearly, there are different models of having cancer care. The most traditional, clearly, is that of comprehensive cancer care centers that are is well established all over Europe, but unfortunately, despite we have also in Italy several CCC, this is not, in our opinion, the only way that we can offer to the public in order to be sure that we are really facing the enormous burden of diseases and the number of patients that should receive adequate care at a certain number of places. The hub-and-spoke model clearly is one possibility that is clearly also in place, in particular for pediatric cancer, is very diffuse also in our country. But all of these models should refer, in our opinion, to something that is even more comprehensive and is more flexible and can be adapted to very different health systems and very different regional conditions. Clearly, there is no, I think, no final conclusion about this. We should work in networks, that's the only thing. How CCC and hub-and-spoke network can be included in a more comprehensive network, that will be a part of the next joint action. There are already clearly examples in Italy and also in other countries. We should try to work together in order, if possible, if we want to imagine a European cancer plan in the future, we should also focus on this kind of aspects that are clearly organization, but also at the end are responsible for the actual implementation of the treatment for the patients. Thanks a lot, and thanks.